નમસ્તે મિત્રો અને મારા યોગ ગુરુ બિરજુભાઈ, હું આપનો ખૂબ આભારી છું અને IAYT ઓર્ગેનાઇઝેશનનો કે મને અહીંયા આ યોગ વિશે વાત કરવાની તક મળી છે. યોગ એ અમારા જીવનનો ભાગ રહ્યો છે છેક બાળપણથી. મારા ફાધરના સમયથી અને પછી એને વધુ ઘણી સારી રીતે આગળ એનું નોલેજ અને એની પ્રેક્ટિકલ એપ્લિકેશન્સ મને જાણવા મળી બિરજુભાઈ અને એમના દાદા એમની પાસેથી. આજે ટૉપિક જે મને આપવામાં આવ્યો છે, ઇન્ટિગ્રેટેડ સિસ્ટમ ઓફ મેડિસિન, એ બહુ બ્રોડ ટૉપિક છે અને title was is a need of the time, but when I realized, I started looking at what to put in the slides and the audience here, I realized that all of us are aware to a large extent that there is an integration already, because અહીંયા બેઠેલા બધા જે છે, everybody has had both Allopathy treatments as well as યોગ, રાઈટ? અહીંયા કોઈ એવું નથી કે જે એબ્સોલ્યુટલી એકલું યોગ જ કરે ને એલોપથીમાં જરાય ના માનતું હોય કે ગમે તે થાય હું એ તો નહીં જ કરું. સો વી ઓલરેડી હેવ ઇન્ટિગ્રેશન, બટ ધ ઇન્ટિગ્રેશન નીડ્સ ટુ ગો ટુ ધી નેક્સ્ટ લેવલ. એન્ડ અપાર્ટ ફ્રોમ ધી યુઝ્યુઅલ ઇન્ટિગ્રેશન, આઈ હેવ વન different idea in mind which I will propose today, and the IAYT and the experts and other people sitting in the audience can take it to a next level. So with that, let me go to my next slide. So when we think of integration, we generally think of big hospitals or doctors' places integrating yoga. So this is a news item from Hindustan Times in 2012 that upscale hospitals have integrated alternative therapies with contemporary medicine to offer patients the best of the old and the new. And Dr. Pratap Reddy, chairman of Apollo Group, officially stating that yoga is a wonderful health system given to us by our gurus, and we in India need to appreciate yoga and the benefits it gives us in keeping ourselves healthy in mind and body in 2015. Okay? So many corporate hospitals across India already offer a lot of different integration of yoga and Ayush medicines, and that is even across the whole world. From Cleveland Clinic to many other big hospitals have separate departments of alternative medicines, yoga and various other therapies in the premises of the hospital, and the patients can avail of both benefits, and regularly people are referring to each other. So doctors are referring patients to these options, and a lot of doctors have even commented that when we could not get our patient a good pain control or sleep or various other issues, then by referring them to yoga or other alternative therapies, we could do that better, and we could allow the patient to get through the treatment in a better way. We did a large clinical trial when I was in US on yoga in breast cancer patients for quality of life, and this was published in the most prestigious journal of oncology. And I will not go into detail, but it basically showed that there was an overall improvement in the quality of life, the emotional well-being, social well-being, spiritual well-being, and the reduction of distress. So this has been, again, this integration is already shown. Now, when we are talking about integration, we, as I said, most people talk about working on the same diseases where the allopathy has anyway been working, or a lot of people have acceptance, or there is a partial acceptance. But there are a lot of areas where we have huge limitation. Psychosomatic disorders of so many varied symptoms and effects. Depression, supposed to be probably the commonest illness today, or one of the 3-4 common most illnesses. Stress, burnout, back pains, headache, acidity, constipation, various digestive issues, seasonal ailments, which we frequently term them as viral infections. So you go to a family doctor or you come to allopathy doctors, we'll say it's a viral infection. That's how we just sort of name it. But lot of people suffer through these so-called simple ailments. Lot of man hours are lost, work hours are lost, menopausal issues, perimenstrual symptoms, sleeplessness, obesity. This is where allopathy has a lot of limitations. And true preventive healthcare is essentially missing in allopathy. So when we have preventive health checkups, they are not actually really preventive health checkups, but they are preventing so-called disaster. So we can say it's a disaster prevention health checkup. That means we'll pick up somebody's diabetes, which has already been there for some time, blood pressure, and we will prevent a heart attack from that or a stroke from that. But we are not preventing diabetes or blood pressure. In those health checkup clinics or the specialized packages offered by all the different hospitals, they are what we call secondary prevention in our fancy terms. It's not a primary prevention. You're not preventing the disease. So my proposition is that we need to focus very big time on this concept. There have been many studies. One of the latest is from the Harvard Massachusetts General Hospital, showing that one of the yoga techniques reduced the health expenditure from average $600 to $25,000 per person per year. So they followed these people for about 2.5 years with this intervention versus the control group who did not have this. So this is huge. When we are talking about a lot of health expenditure that even economies like America cannot afford, then we as a country can show path to the world by preventing diseases and reduce the health expenditure, which is much better than treating these diseases. So what I am proposing is a yoga for wellness rather than treatment of diseases. Of course, that is an important part, but the definition of wellness is an active process of becoming aware. And becoming aware is one of the biggest foundations of yoga. So if you are aware of your health, then you can pick up the disease in various stages before it becomes manifest. As per Ayurveda, I believe there are some 7 stages of disease before it becomes manifest. So if you can pick it up before the seventh is when we come in, the allopathy doctors, we make a diagnosis that now you have this disease. Okay, you have high blood pressure, you have diabetes, you have thyroid, you have this, that. But there are 7 stages. So if you are aware, you can prevent it way before and actually divert the process into a different healthy direction. So the wellness is process of becoming aware of and making choices towards a healthy and fulfilling life. That is very important. Fulfilling life. It is not yoga, the goal is not to become somebody perfect. That you have a perfect weight, perfect height, perfect skin, perfect hair, this, that is not the goal. We are not going to become perfect, but we need to be healthy enough to make a fulfilling life. And it is more than, of course, being free from illness. So we need to do the integration from the grassroots level, from home, school, college, office level, and focus on 3 aspects. Wellness, that is the prevention, true primary prevention. Second is diseases where allopathy has major limitation. And third is complement allopathy as part of hospital or clinical care. And that I give the last and the least importance, because that is where the value addition is going to be much smaller than the value addition we can do from the first step, because that is where we can show path to the world. And how we can do that, I'm sure there will be a lot of deliberations and a lot of experts sitting one simple idea that came to my mind, which needs more deliberation but something to put forward, is the concept of family wellness expert. We all are aware of family doctor. So that means once you get sick, you go to your family doctor. But why do you wait till you get sick? So my family wellness expert is Birjubhai Acharya. So he truly, this idea has come from how we have been working with him for so many years for our own health. He allows us, he takes care of us in such a way that we actually don't get to the problem. And how do we do that? So what I propose, there are many different ways to do this, but one would be this family doctor or family wellness expert will have a weekly or monthly visit to your home, or you can go to his clinic or whatever place. We don't call it clinic, maybe it sounds like for sick people. Okay? So you go to his place, his ashram, his office for once a week visit or once a month visit. You have their yoga class or something once a week, which will make sure that you are doing yoga in a right manner. What you were taught, you have not digressed and you are doing a completely wrong technique. So this will become a sort of audit by the expert. And then he can advise you when he comes to your home, he or she, related to home design. So we know that Vastu has lot of health related impact, okay, and happiness related impact. For example, airflow, sunlight, water, what kind of water, how much water, etc. Cleanliness in the home, sleep, various food related advice, exercise, seasonal changes in diet and exercise. These are all the art which is being lost. We don't know now as to what to eat during what season, how much to sleep, what exercise to do, whether to do fasting or not. These were inbuilt preventive systems in our religion and culture. And this lost art can be brought in by the family wellness expert. And of course, home remedies for minor ailments. So we don't keep running to family doctor for very, very simple things. For every little cold, cough, abdominal pain. Now there is a growing awareness that antibiotics, even a single course of antibiotics, alters your gut intestinal flora so much that it leads to various different problems. There was one study that one course of antibiotic given to middle-aged adults led to higher incidence of colonic polyps in these adults over the next few years, just one course. And colonic polyps are a precursor to colon cancer. So this is not trivial. Okay? Just one course of antibiotic. But if we run to doctor quickly, we want very fast relief. And because now there is a huge, I think a large majority, we don't know what home remedies are. There is a group of youngsters, the whole generation now is not aware of how home remedies work, what should be taken. They either are not aware or they think that this is something very unscientific. So these all can be brought in by the family wellness expert in a more refined manner into the homes. And first thing I thought that, when I talk about it, people will say, oh, it won't work because it's not financially viable. So being a Gujarati and a Shah, I first made some calculations. So can it work or not? Okay. So it seems like it can work. So I just thought of my society where we have 120 flats, okay, 20 apartments. And if even 25 or 50 people agree to this, and maybe the next society about 25, 50 people agree to this, then one person has to give them 1 hour a month. That means if he works only on weekend, he has to work Saturday, Sunday 6 hours each. Okay? And if he charges rupees 500 per month per home, for people of 4, 6, whatever number of people, he can earn 25,000 a month. That sounds great compared to so many engineering graduates, commerce graduates, etc. So many people today can earn, and that too, this is many flexible hours. And this, in addition, they can charge extra from whatever additional advice they have to give, or they have to provide home remedies, etc. They can work with other experts. So that can be a pyramid system. These people don't need to be very, very well trained, but they need to have a passion for health, passion for preventive health, and then they can be guided by senior experts. For example, Birju Bhai or other yoga therapists who have been working in this field for several years, Ayurvedic experts who have been working for several years. They can guide them to the next level. And that, since there is no investment in this, everything is profit, okay? And you are covering this one area, one society, so you're not going around, running around the whole city also. Now, an expert can map out their Prakruti from Nadi Vidya prior to this start, so that he knows what is the general idea that I should be giving these people regarding the food. There are also questionnaires that you can fill out, and you can know your Nadi, whether you are a Vat Prakruti, Pit Prakruti, or a Kaph Prakruti. So accordingly, the diet, exercise, and basic advice can be given from the start to these people. And of course, they can, in addition, hold monthly seminars for these families by various seniors, experts from other Ayush branches. So a general concept of wellness grows among the community at large. And I would recommend that IAYT create a pilot project like this, work formally with IIM or any other academic center, so that there is a good data collected and there is more authenticity, and whatever flaws in this system are corrected, and then it can be taken to a larger level. It will provide lot of employment also, apart from reducing healthcare utilization, and it can be also taken to not only individual homes but to organization. You can go to, say, a bank, and you offer this service that we will do this for your employees once a month, okay, and we'll charge you whatever, say 100 rupees per employee or 200 rupees, whatever. And then there can be this pyramid system, so anything more difficult, a next level senior can be called in. So it can be offered to schools, other communities, even geriatric care. Lot of nursing homes and elderly homes will have lots of different health issues, out of which a large majority, at least 50% probably, can be taken care of without the allopathic medicines, and that can be done at their doorstep. Neonatal care, child care, Garbh Sanskar, maternal health, don't leave it to only grandmothers. Those knowledgeable grandmothers are fading away, right? We don't have as many knowledgeable grandmothers in every family now. So somebody needs to take care of this, so that this healthy tradition continues and it does not become an anecdote. મારી grandmother કીધું છે એટલે આમ જ થાય, એવી રીતે નહીં. There is some kind of science behind it, some experts backing it, so it does not become anecdote and no wrong treatments are given that way. But majority can do a very lot of good to lot of families. So make it professional, scientific, and I'm sure it will be cost effective, at least from my initial maths that I have counted. Make printed material, so it is not just this is what I think. આમ જ થાય, મને પૂછવાનું નહીં. આ મારા પહેલાં આમણે કીધું છે, મારા આણે કીધું છે. So there is a basis for that, and that way it becomes acceptable to the current generation. Current generation will not take it like this, કે કોઈએ કીધું છે, સ્વામી મનુવર્યજીએ કીધું છે એટલે આમ થશે. ના, આટલું એવું નહીં લોકો સ્વીકારે. આજે લોકોને રિટર્ન મટીરિયલ જોઈશે, ઓડિયો વિઝ્યુઅલ જોઈશે, કંઈક સ્ટડીઝ જોઈશે, ડેટા જોઈશે. Okay? So we have to parallelly prepare these things to make it on a much larger way. And the rich people already know this. Okay? So like I said, I am already taking advantage of this with Birju Bhai's help, with his insight. So I am already aware of this, even though I am an allopathic practitioner. And I know that in the audience and in Ahmedabad, lot of rich people are already taking advantage of this thoroughly. but we need to take it to the masses by creating this army of healthcare, the family wellness experts. Okay, it can be the services can be provided to government hospitals and trust hospitals once a week, completely free of care for poor people. That will also enhance its reach. So, in summary, we need to do three things: service, education, and research. The service aspect I have elaborated. Education, we should do this from school, college, and home level, and with more currently accepted tools. And we need to do research, healthcare utilization in Indian setting, how much feasible it is, work with disease specific initially. Say for example, migraine. You take patients with migraine, do a study, involve academic centers, and publish the data in and publicize them in the local media, newspapers, and journals. But please don't copy allopathy research method. That's a caution I would like to make, because allopathy research methods are not easily applicable to other alternative branches of medicine. In fact, we started in allopathy with the idea of having large studies where we should have 1,000 patients, 10,000 patients. And then now we are ourselves struggling with the idea of personalized medicine, because we realize by going into much deeper level that individuals have different traits, different genetic makeup. So everybody cannot be treated in the same manner. So the world is circle, they say. That is what Ayurveda Yoga said years ago, that everybody is different. You cannot treat everybody same way. દરેકની નાડી અલગ હોય, પ્રકૃતિ અલગ હોય. You have to have an individualized approach for everybody. So please don't make a clinical trial of a very general thing that everybody will have the same system. So we can talk about those details later. But in general, I think we need to do research in parallel, and we can show way to the world in true preventive healthcare. Thank you.